Hi, I'm Dr. Valas from the Family Pet Hospital in Ashland, and I would like to help you understand veterinary orthopedic manipulation as a treatment modality, and to see if that would be something that would be beneficial for your pet. I'm going to have Judy, my assistant, ask me some questions, and hopefully it will get some clarification. And obviously, you can always call me with more questions that you might have. So go ahead, Judy.
All right. So Dr. Valas, what is veterinary orthopedic manipulation?
Okay, so veterinary orthopedic manipulation is basically using this tool, which is like an activator tool in chiropractic, to essentially do a neuroanatomical adjustment. And what that means is adjusting the spine from the neck all the way down to the tail so that your dog can, or cat can, or horse, or whatever you have, is in better communication with the rest of the body, allowing it to heal better.
Okay. And is veterinary orthopedic manipulation known as anything else besides VOM?
No, this modality was started by Dr. Inman, and it is a type of chiropractic. Unlike chiropractic, it's using the entire spine. It's adjusting the entire spine. It's not just looking at where there's a problem. In a lot of chiropractic work, you find where the maladjustment is, and you adjust that. In veterinary orthopedic manipulation, it treats the whole animal as a system, and it uses adjustments along the whole spine. The way I like to think about it is, if you are not well adjusted in one area, it's like a domino effect, so that other areas in your spine are off. And so it causes chronic problems all over the spine. So it could be called a form of chiropractic, but it is a lot more than that.
Okay. And is VOM the same as chiropractic care?
Not really, for those same reasons, in that you're using a tool that is used in chiropractics, like the activator, which I just showed you, this one, but it is doing more than that. It is adjusting the entire animal, not just one area in the spine of the animal.
Okay. And when would my veterinarian recommend veterinary orthopedic manipulation?
So technically, it can be used for many problems. I use it most frequently for orthopedic problems like hip dysplasia, knee injuries, ligament tears, lamenesses of any kind, back disease, disc disease, problems of that kind. However, if you think about the spine as a system of wires going from your head or your brain to all the other organs in your body, essentially, when you're using this manipulation, you are allowing communication to go from your brain to all the organs in the body. So if there is a maladjustment at a certain area of the spine, you could have pain in that area for sure. But in addition to that, the nerves that are coming out at that segment of the spine are also going to maybe the kidneys, or maybe the bladder, or maybe the intestines, and causing other issues internally. So veterinary orthopedic manipulation can be used for a multitude of diseases, not just chiropractic type or musculoskeletal types. But that is the number one reason why we use it here, is for pain related to the joints or the back.
Okay. And why haven't I heard of VOM technology before?
Well, that's a good question. I think that we live in a society where we want to go to the pills and the treatment right away. And so the fast cure for pain is to take a pain medication. The problem with that is that you're not affecting a healing at the point where you hurt. You're just taking away the pain. obviously also, and this may be a little political, but we make a lot of money. The pharmacies make a lot of money on medications, and that is the number one driver of the research that is done out there, is what pill will take care of what condition. And so there's very little information and very little research that is funded but to alternative healing technologies. And I do think that chiropractic work, VOM, laser, which we'll talk at another time, they're all integrative and alternative modalities that do not make big money for big pharma. And so they don't have the research dollars behind them to really promote it and push it into the mainstream with advertising, et cetera, like we have for all the other medications that we use.
And what are the risks of veterinary orthopedic manipulation?
So that's the great thing, is that this doesn't have any risks. The worst that could happen is it doesn't work. The good news is that it works in a good number of cases. And in my hands, I've seen like 80% of my patients will improve or get completely turned around and not need any more meds ever. So the only risk that we could potentially see, and even that is unlikely, but one of the benefits of veterinary orthopedic manipulation is that it increases blood flow to the organs, right? So the organs get better. But if there is a cancer that's growing somewhere in the body, then obviously that would also increase blood flow to that. So in cases where there are tumors or big cancers that are drawing blood from the system, they will also technically get fed more. Now, having said that, in most cases, we do screen animals to try and make sure that they don't have cancer, that we are dealing with something that is not a cancerous process, because that wouldn't necessarily be helped by veterinary orthopedic manipulation. It may be harmed. So we would try to do our best to make sure that the animal does not have cancer.
Okay, and why is VOM so accurate?
Well, you're literally taking a motion from the veterinary instrument, from this little instrument, and applying it to the segment of the spine. So essentially you are doing it, and you're doing it with this instrument, and I'm going to click it. So that's how fast it applies the motion at the point where you want it. So compared to a traditional chiropractic adjustment, where the practitioners using their hands, so your hands, my hands, no matter how fast we go, we're never going to be as fast as the tool. So the tool is very specific in that you place it right on the top of the spine, and it gives the pulse before the animal can move. So again, this is another big thing with chiropractic work in animals, is that if you're doing a traditional adjustment and the animal moves, well, you probably haven't done an adjustment. And in fact, you could have actually harmed the animal at that point because it moved, and you can't tell the animal not to move. With veterinary orthopedic manipulation, with this tool, you do it so fast that if the animal moves, it will not change the adjustment. You will have effective an adjustment at that point in the spine.
Okay, and what can VOM treat?
Again, most of the time we're dealing with orthopedic issues. So one of the best success that I have had is in anterior cruciate ligament tears. And I could say that there is an epidemic of those in this country and probably in this world. And many, many dogs before VOM, I would say 100% of the dogs that I saw with an ACL tear or anterior cruciate ligament tear of their knee would end up in surgery. And unfortunately, about 80% of those would tear the other knee. I would end up in surgery again 2 months to 2 years later to get the other ligament in the other knee fixed. And what I found now is that instead of 100% of those dogs, I would say less than 20 to 30% of those dogs actually need surgery. And when I first started doing this about, I would say 7, 8 years ago now, I thought that it was only going to be the little dogs that would be successfully treated with this technology. Since then, I have had Labs, German Shepherds, Rottweilers have successful use of their knee without loss of muscle, which is what's very common, like in cases where people cannot afford the surgery because it's, $3,500 a knee. They would continue to live. We wouldn't euthanize them, but they would lose significant amount of muscle in their legs and essentially use that leg almost like a peg leg. With veterinary orthopedic manipulation, they go back to full function and they have muscle in that leg. And that doesn't mean like just the little dogs did that or the big dogs. It doesn't matter. All of them will respond if they're going to respond. And as I said, 70% of them do and do not need the surgery. And yes, maybe if they don't continue to be adjusted on a regular basis every 3 months or so, they will go ahead and tear the other one. But guess what? When they do, the other one will respond as well if they responded the first time around. So that one is incredibly successful. The other one that I found is I've had a couple of paralyzed dogs. Now I do use the laser, both of those diseases. I use VOM and cold laser therapy, but I've had a couple of paralyzed dogs who could not afford to go and have back surgery done to remove a bulging disc that had caused paralysis, and also responded to veterinary orthopedic manipulation and laser therapy. So those are very classic and very good examples of how powerful this technology is. Above those, hip dysplasia, just dogs that have been born with bad hips and are now like 6, 7 years old and would be having to take non-steroidal anti-inflammatory drugs for the rest of their lives, in addition to joint supplements. These dogs get really comfy without drugs and just on the nutritional supplements and regular veterinary orthopedic manipulation treatments. So those are my classic examples of that I would say this is very successful for.
Okay, and can all my animals be treated with VOM?
Yes, and in fact, when I first did the training, they had a dolphin at SeaWorld being treated with veterinary orthopedic manipulation. They also had several cats that were, more of the exotic cats that could be handled. And obviously not all exotic cats can be handled, but the ones that could had that. You also be used in a mouse. It can be used in a bird. It can be used in a rabbit. So any animal that has a spine and a brain and nerves going through that can be treated with veterinary orthopedic manipulation.
Okay. And why is VOM so successful?
Well, that's a hard question to answer if we try to think with the traditional way of thinking, but really not so hard if we think about what the body is doing every day. So the body is a system of communication, and it's in constant communication with the brain. And the brain is like the motherboard. If we think about the body as a computer, we have the motherboard in the head, and then we have all the wires going everywhere else. So as long as the body is in communication with all the parts in the body, then the body is going to do what the body does every day. And the body heals itself every day. In fact, when you wake up in the morning, you're not the same body that you went to sleep at night. Lots of your cells have been replaced, and the dead ones have been killed and eaten away, and new cells have replaced those. So you are in constant communication and you're in constant state of healing. The problem happens when disease hits, and that stops or blocks the communication. And what the body tends to do, especially say you injure a leg, what the body tends to do is withhold stuff from that leg. So fluids, blood, it basically pulls away from that area because it hurts and puts every effort into all the other areas and tries to ignore that bad area. And if that stays chronic, if that stays put, then essentially you never get a normal functioning area. And that is the classic reason why you get a new normal, you get a gimpy gait, you get a lot of arthritis and sometimes even deformities at the area that it's been withheld from. You lose muscle in that limb. And that's because the body has stopped communicating. It kind of got, sick and tired of being sick and tired and said, you know what? I have a lot of other areas that I can take care of. We're going to forget about you. So veterinary orthopedic manipulation, laser, acupuncture, all those alternative healing technologies are really based on getting the body back in communication with itself so it can do what it does every day.
Okay. And is VOM an easy treatment?
Incredibly easy. So it's really something that is quite spectacular in how easy it is. The surgery for ACL is not easy, and it involves breaking the bone and replating it with 6-7 screws. It's not easy, and it's not non-invasive. This is very easy, not painful, not invasive, and certainly not as expensive either. And again, it's working with the body's own way of healing by just reestablishing communication with the area of injury. And by the way, the reason that it works so well as well is because it takes away the pain right away. Now, I've had chiropractic work done on myself with a activator device very similar to the VOM tool. And that is like the first thing you notice. You're like, boom, whatever was there hurting, it goes away. And yes, it comes back. So that's why you have to go back and get another treatment, because the body doesn't stay, it doesn't stick. You have to build muscle memory. You have to tell the body it's okay, it's okay, it's okay, it's okay, until it's done its healing. But it works like a charm and is very, very, very easy to do.
Okay. And then what will happen to my pet during a VOM appointment?
So what we do is the technician stands by your pet on one side of your pet, and I stand on the other side. And we take this tool and we go right from the neck and we click it all the way down the spine. Okay. So it takes about, maybe, I would say the whole treatment, maybe 5 minutes each time. And he's not being held. He's just standing there. What I find is the first time that they do it, they react a little bit to the noise because it is a little click. But after they figure out that the click doesn't hurt, and on top of that, it seems to actually take away their pain, they relax. And what I've also noted is that sometimes they'll actually push their back up to get more of it. So if I'm not putting enough pressure on it, or because I'm really not putting pressure on the device, I'm just laying it on top of the joint. Let me see if I get that camera, and then just pulsing it. So sometimes the dog will kind of push their back up to get to the device. And that to me is an indication that they like it. And they don't move, they don't have to be held. In fact, if you are holding them too much, then I stop, because it's not going to work that way. You need to have the animal relaxed, standing, and they love it. And we do 3 passes. So we go back to the neck, go down the spine. We do it 3 times, and then they go home and come back for the next treatment.
Okay. And then what types of tools are used when you perform VOM? I know you showed us that one tool, but are there any other tools?
None. That's it. That is the only tool that needs to be done.
Okay. And what's that tool's name again?
This is called an activator. So it's a chiropractic tool, and it's a little bit different, but the same concept as the chiropractic activator tool. I call it the VOM tool.
And then how many appointments will my pet need?
So the first series is a series of 8 treatments, and I feel like that's what's needed to get a full adjustment after an injury or after a problem. So we do 5 weekly treatments, and then we do another treatment 2 weeks after that, another treatment 3 weeks after that, and another treatment a month after that. And this is going back to the muscle memory, building the muscle memory, telling the body that it is okay, that it's not going to hurt, that you can keep going, and allowing that flow of blood and fluids to go into the injured area to heal, to take away all the arthritis, eat away the inflammation, clean it up, and start laying down new cells and new tissue to either stabilize or completely heal the injury.
Okay, and is there a recovery time period?
No, but yes, in the sense of that, especially with the cruciate tear, you do have to rest your dog. So, and back issues too. So there will be a time, especially at the beginning, where no exercise should be done. Now, soon after, when the dog is putting weight on that leg, then we start telling you to do short walks, maybe to your neighbor's house and back, and doing that 2 or 3 times a day, and then longer and longer and longer walks, because what we need to do is we need to build up muscle. Whenever we have joint issues, we want to make sure that the muscles take over for where the joints can't. And in fact, if you think about it, if you didn't have muscles, ligaments, or tendons, then you would be a rubble of bones on the floor. So what's keeping you upright is not your bones and it's not your joints, but your muscles and your tendons. So we don't want to give them a really long, protracted period of rest. We want to get them up and moving as soon as we can, and using those muscles. But yes, you do not want to let your dog off leash and let him chase a squirrel where we are just starting the treatment, because then you're going to go 1 step forward and 5 steps back, because he's going to keep re-injuring that same area. So we do want to be careful. We do want to keep them contained, and we want to do controlled exercise to build up the muscle.
Okay. And then last question, how soon after a procedure will I notice a difference in my pet?
That's a great question. So usually I say the magic happens between week 3 and week 5. I sometimes get this calls with, what in the world did you do to my pet? Because they're like a new dog after the first treatment. I think that's to me, in my mind, is completely impossible. But I think that it comes from the fact that it shuts that pain away. So if the dog has been chronically painful and then they have a treatment and that day they don't feel pain, they're going to act like they're a puppy again. They're just going to feel great. So that's a little bit of a danger of this technology, in that if you think that they're doing great and you say, oh my God, they're doing great, and you let them go, they're going to get injured again. So I do think that they feel better right away, but I think we see a real difference in the ACLs. Is usually week 3 to week 5, where we see full weight bearing on that leg. And when we see that, we know that we can now start walking them and using the muscles, and continue to get more blood flow into the knee, decreasing the inflammation, decreasing the pain, and increasing the function. And ultimately, with any technology, with any surgery, what we are after is full function, getting the animal to function well. I had a lab this morning that had both ACLs torn, and he comes now every 4 months. And every time I ask him, like, what's he doing? How's he doing at home? Full function, both muscle bellies fully formed, no evidence of any pain or, I don't know about arthritis because I'm not doing x-rays every time. I'm sure there has to be some arthritis, but again, remember that we are increasing the blood flow and the lymph flow into the joints as well. So we are cleaning up those joints. So I bet that arthritis is decreased. So they do just tremendously after that.
Awesome. And then if anybody has more questions about veterinary orthopedic manipulation, what should they do?
They should call. So I would say call 508-231-1223. That's the practice, the Family Pet Hospital, and ask to speak to Dr. Valas. We always have a no charge, no commitment consultation. I go over this with you guys, and I give you the estimate for the treatment. And then if you want to go forward with it, we go forward with it. Otherwise, you can go and look for other treatments, because there are other modalities. I don't think that they are as effective. I used to send a lot of patients that didn't want surgery to acupuncture. And, it was maybe 1 in 5 that would do well. And then the other ones would end up in surgery or on chronic medications. So you can always call me. You can always ask around. You can always look for more information online. I think that this is a good alternative to surgery. I think I myself, I'm not really happy about considering surgery for myself. So I feel the same about our pets. I think that if we have to go to surgery, we should. But if there are other things that can be explored and used in lieu of surgery that may prevent us from having to do surgery, then I think those options should also be explored.